Hello, friends, or good day to all of you out there. Warm welcome to today's discussion. Thank you very much for joining in. So happy to see you guys. Manha Mutawakkil Dunya, Fahima, Hina. Thank you so much, Lai. Thank you very much, Mehrunisa, Prarna, sweetheart. Thank you, Rizwana, Sabah, Sadia, Shaima. Thank you so much, Vidhi, my girl. Thank you, Yasmin, Muna, Sohar. Warm welcome to all of you to the next step and the next journey. Proud of you guys. Wa alaikum assalam wa rahmatullah. Thank you so much, Fahima. Thank you so much. Big hello from my side. I hope the voice is audible and clear to all of you out there. Yes? Thank you. To begin with, a very huge congratulations on spectacular results of the MRCPI March 2023, breaking all the old records of all the count which you people have made. Hands in hands, like a family. Once again, you proved yourself to be the best out of RFA alumni. Thank you to all the champions having faith in us and making it a success. Thank you very much and congratulations to all of you once again. The question is now, for what we are meeting today is MRCPI OSCE, Muna. What is MRCPI OSCE, Sadia? How to prepare, ma'am? Manha, is this time enough to go for May or shall we plan for November? Lots and lots of questions are there. And here I am today to address all the queries, all the questions, and we are going to take a decision together. We'll tell you what OSCE is all about, how we have been doing, how much time is enough, what is required in preparation. So we are going to take a mutual decision today after having this discussion. Thank you very much, Razia, for joining in. A very warm welcome to all of you. Thank you so much. All right, so to begin with, I would like to tell you that every task when we start, no matter it's a theory exam, no matter it's an OSCE exam, always taking a start is confusing. Always taking a start seems to be foggy. Always when we take the first step, we have lots and lots of queries and questions in mind. The moment you start taking baby steps, the moment you start going into the gist of the preparation, the things that become easier. And you all would agree with your previous preparations as well. When you people first time picked up the books for MRCPI written, you people didn't understand what is the right direction. Even if you remember in the last minute and the fast track, when you were doing lots of single based answers, I used to tell you guys that you would see that the things won't be that difficult in exam. The questions will be pretty clear. They will give you the hint and you will find it comparatively easier as compared to the exam tested questions. And today is the proof for that you all are here making the first step towards the MRCPI OSCE. So I would like to reassure Razia, walaikum assalam, sweetheart, that when we begin, we always have lots of queries, but when we start the journey, gradually the things are clear because we start learning. And the most important thing is that we start getting confidence in ourselves as well. Thank you very much for joining in, Ahmed, my dearest. Thank you so much. Wa alaikum assalam rahmatullah from all of us as well. Thank you. Okay, so people are joining. Atika here as well. Warm welcome, Atika. Thank you so much for joining in. Okay. So this question, how much time is enough? The answer is different for different students. For example, one FE student has taken the OSCE, maybe the European Board OSCE or the MRCOT OSCE, has been through that time of speaking and presentation. So for those students, it is very important. It is going to be a situation where you need to understand that for them, the things are comparatively easier. Comparatively easier. Why? Because they've been through that drill. As compared to those who are taking OSCE for the first time and they've never spoken in any of the exam for the OSCE, yes, the time is less. I won't say that it's not doable. It's definitely doable, but yes, I need more time for them to prepare and to spend in preparation. So this is the first thing. I cannot make a certain rule for all the students here that, 1 month will be fine or 30 days will be fine. It actually varies according to your background knowledge and your experience of OSCE. Do you guys get that? Okay, this is number one. Number two, it also depends upon how much time you can give. For example, Sadia says that, ma'am, I can give like 8 hours. And for that matter, Yasmin says that I'm so difficult. It is like I am having a concern. I can give only maybe 3 hours because Ramadan is here and lots of other commitments. I might be traveling. I've got some domestic commitments. If that is the scene, then yes, you need to take a very wise decision, as many of you have registered for the November. The first thing is that both the courses are open. The one which has been decided for the May, and the one with the November as well. That's number one, which you people should be knowing, right? Walaikum assalam, Mehreen. Thank you so much, Roshna, my dearest. Thank you, Yasmin. I will come to this. Every question, I'm here to address every question, Yasmin Khan, and I will tell you everything about that, okay? Now, see, when you guys have decided that you're going to take it, I need a preparation of full throttle, because 30 days means that we have to know everything which is required. Whatever I'll give as the course schedule, that is the minimum topics which you people have to remember. The best point about you guys is that you people have already been through the theory part just now. So the structured discussions are not difficult for you guys, because maximum they come from that theory part, which is easy. So you just need to practice speaking. I do not doubt your applied clinical knowledge, because that's awesome. That's brilliant. Just because we just had revised everything in detail for the theory exam. So that's the best part for you guys, for which I have less concerns, rather than those students who take part 2 written way too earlier and the OSCE with a little gap. So that's my basic concern about those who are taking with a gap. Of course, you need to revise the theory part, but the one who are having the fast type of preparation in terms of the theory parts just been revised, it's going to be easy for you guys. All right. Again, if you people can give 6 to 7 hours from now, this exam is doable, right? 6 to 7 hours from now, this exam is doable. It depends, again, how much time you can give, how much is the experience of the OSCE for you, maybe your little communication and your background in the language barrier. I would say that yes, 10% it does matter. If you can practice from today, this is a doable exam which you all can do. This is the suggestion to begin with. I know many students. We had done this MRCPI OSCE probably in like 20 days. I know my students who have taken MRCOG3 and MRCPI OSCE with a gap of 10 days because the preparation they had done. You would have so many shining stars. I know all the older students, they had done in such short time period, not because they actually were prepared already. It's basically the gist they could do, and they started speaking. The difference between the shining stars is that they knew basically that what is going to be the situation where in exam, for written, you were doing the theory part, you were practicing the single best answers. What we need now is the speaking of the same. And all the previous batches, they had done awesome job. Similarly, the previous one in the Kingdom of Saudi Arabia, the February one, they did spectacular results. All right. Now, my concern for you guys is to have an encouragement and having faith in yourself that you can do it. This is the first thing you people should be knowing. This is the first thing that you people should be knowing. Like them, you all can do it. And it is something which is doable for all of you. Let's have an encouragement to begin with. We'll come to the task and see that how did they make a success. so much. So the first thing for taking any step is, friends, that you know that you have faith in yourself, you have confidence in yourself, and you can do it. So let's aim first that which exam are we taking, and then organize ourselves. This is the basic agenda to meet you guys today. The first thing is that people who are in November exam, I would request all of you that you have got an access of the library, right? And you start doing the library revision of the guidelines one by one for yourself. That is essential so that you stay in touch with your studies and you don't get off track because you just had passed your MRCPI written. So I don't want that, you feel after 2-3 months that, oh my God, it's all an alien thing and we have forgotten everything. This is for those. Thank you very much, Bushrabit, for joining in, my dearest. Thank you so much. Warm welcome. So you have to aim this today that you people decide. Already the ones who are registered, they are in the May group and in the November. Many of them are in the May group in 125 USD. They'll be doing an extension to the November as well. So that's something which they know they would be doing. Sidra, thank you so much for joining in, my dearest. Now, the thing is that from today, everyone, I want that you guys make a notebook. This notebook would be MRCPI OSCE preparation. Okay? The first thing which I want you all to understand is that we have got two options as per the clinical exam for the OSCE. One is that we take it in the May exam, that is going to be 13th May in Ireland. For all my Ireland students, please, for all of you who have registered, 13th of May, we are going to appear in Ireland. And then we have 13th and 14th, 2 days exam in United Arab Emirates, Dubai. Okay. After that, we don't know the date of the November. It's still to be communicated, but it would be again in November in Ireland, and we would have in the United Arab Emirates as well. Okay. So with this, you guys should be knowing exactly, yes, they would still confirm Atika, and this is going to be May and November. You should aim today so that we can be organized. All right. You should aim today only so that we are organized. And all those who are for May, 13th May means that these 30 days of April, and then we have got 2 weeks for revision back to back. And this is absolutely doable if you people understand the system, which I would tell you today only that what you guys have to do. Now, about OSCE. Remember that OSCE is something, the final set, where they want to see you head to toe, that yes, you people are eligible to get this degree. It's an objective structured clinical examination. Remember, whenever it's objective structured clinical examination, please try and understand that you people should be knowing about that they have fixed keys. They cannot mark you by themselves. You have to come to the key, you have to reach to the key, and then you have to accept what's going on in terms of the talk with an examiner. But please stay to the task, and accordingly, you people will be getting the score. That's the most important thing you people should be understanding. Now, for the last few exams, they have had the similar pattern after the COVID situation. In the older exams, it used to be clinical patient scenario, and you people had the regular patients in that situation, right? If, Roshna, I'm going to take all the questions, my dear, one by one. Please keep the questions. All these questions I'm going to take once I just explain the OSCE, okay? No, I will tell you, Roshna, I will tell you exactly what students they do. Okay, sweetie? So now what I wanted to tell is that you people should be knowing about the OSCE in this situation. You should be knowing that after COVID, no actual patient so far. Till date, they've not made a change. No actual patient is there. Point noted, everyone. What does it mean? If they give you, for example, a patient of a sickle cell disease and you need to talk to that patient, it's not going to be patient actually, it's going to be a simulated patient, that is a player talking to you who would be knowing that I have to tell this answer to the question which the candidate would make to you. Do you guys understand? Yes? So no actual patient is there. Do you guys it's good, or do you guys think that it's bad? Do you guys think that it's good, or do you guys think that it's bad? I mean, is it something advantageous, or is it something as a disadvantage? What do you guys think? Roshna, Atika, Razia says it's very good. Samya says it's very good. Okay, I agree with you. Reason for that is before the COVID times, when you people have got, for example, a heavy menstrual bleed fibroid case, and your abdominal examination is not exactly fine with that of the clinical examination of the patient with a 20-week size fibroid, yes, you are in a difficult situation. I mean, the examinations, many of the students that, they are not into that perfect situation. And at times your examination skills might get under nervousness, might not match. For example, picking up a cephalic presentation in an obstetric case and, mixing it with a breech one. Do you guys get that? So, no, it doesn't mean, Mehreen, please just follow the task I will tell you. But whatever you will be doing would be on this simulation like a dummy. Okay, but there's going to be a model for that. Okay, the benefit of that now is that you are not assessed for the examination. You're assessed for the steps. But the findings of the examination, you're not being assessed for. They give you the finding, but they do check every step. They do check how you do the general physical examination, how you do the systemic examination, how you do the abdominal examination, the 4 quadrants, how you go in an S-shaped manner, how you're doing the deep palpation, how you're palpating a mass, like for the structure, for the surface, for the tenderness, for the adherence. Everything counts. But the findings are something which, after seeing you, they'll give by themselves. Do you guys understand? Do you guys understand? Yes? So this is the benefit of having a simulated tasks that we don't have the original findings in this. In the older exams, it would be difficult because the situation, yes, Mehreen, I have a request, everyone. Please let me finish in a stepwise manner. Otherwise, you people won't understand. I'll take the MRCPI OSCE like a story with you guys. Once you guys understand everything, I will explain and I'll take each and every question, please. Okay, so that you guys understand. Okay. Now, you people have understood this point that so far till May, instructions are there. There is no patient actually. Do you guys understand? I cannot comment upon November because they have not announced that whether they'll go back to the pre-COVID times or not, right? But at the moment, it is still that no actual patient would be there till this point. Could I make myself clear? Please tell me, so far, did you people understand that it is going to be anywhere? It might be in a hospital. It might be in some sort of a hotel as a venue. But you people should understand that we do not have an actual patient. We would have patient tasks, but a person sitting as a patient would be a role player who has been guided to answer your questions according to the task or the condition and the disease. Clear? Perfect? Okay, thank you. Now you people have to understand that you are being assessed by different things, like you can be given as an investigation, you have to interpret that. You have a communication task, you have to understand that. Like MRCOT Part 3, where the back-to-back stations are there, where 14 stations are back-to-back. We are blessed in this situation here in exam for MRCPI that one rest station is there. Okay, one rest station is there. That means what? That means that when you are moving in a circuit, and for example, you've got 7 cases, 1, 2, 3, 4, 5, 6, 7, 8. Out of them, they just mark maybe station number 3 is a rest station for everyone. So you start moving from 1, for example, in each circuit, we would have 7 candidates, right? They would make it 8 candidates for each. Why? Because the first one would be outside station number 1, then 2, then 3, 4, 5, 6, 7, 8. So 8 candidates would revolve around this circuit. In that circuit, you should be knowing that 1 student number one, candidate number one would be moving to the two, two would be moving to three, three would be moving to four, four would be moving to five, five to six, six to seven, and seven to eight. When you reach to eight, you go back to one, right? So it depends, for example, if you're starting your exam at station number four, you would end your exam at station number three. Do you guys understand? So in a clockwise manner, you start moving in a circuit. Is this point clear that how circuit works? In the circuit, you have in between one rest station. That might be your first one if you're starting from station number three. For example, if three is a rest station, you might have somewhere in the middle, or it might be your last one. Do you guys understand? One out of that would be a rest station. In that, for 10 minutes, you would be sitting on a chair and you'll be taking rest. Others would be in a continuity. Do you guys understand that how the station works? How the station works. You keep on revolving in the 8 circuit. Out of them, 7 are the solving circuit stations, and 1 is going to be the rest one. And you go according to your number. For example, you've been started with station number 2. You will go to 3, 4, 5, 6, 7, 8, and 1 would be your last one. Am I clear? Am I clear? Did you guys understand this point, please? This circuit generally can be two ways. In the recent exam, the long cases were in the morning and the circuits were in the evening. But there can be a situation where the circuits are in the morning. For example, the last Dubai exam or the Oman exam, the circuits were in the morning and the long cases were in the evening. So it's absolutely, it varies according to how they decide, but they email you around at least 10 days before exam that what would be the pattern, and they give you timings for your registration, individual timings for your registration batch as well. Okay, because they would make 8 students in one batch. Got it? And then they'll make another batch. So in one day, there can be 2, 3 batches according to the registrations of the exam. Am I clear? Am I clear, please? Are you getting a hang of it, please? Yes? Now, out of these 8, what would be? Okay. I thought there was some question. All right. So, Salma, my dear. Yeah, mute mode. Thank you so much, sweetheart. All right. So now you people have to understand one more thing for circuit. But this circuit, I'm going to explain to you guys that you people should be knowing that it is going to be a situation where because we have got 2 days. The exam is being conducted 2 days, my dear. That's why. Yes, no. One day is different exam and the next day, never the cases are repeated. It's a different exam. Always different, my dear. If 2 days is there, we get an idea from day one. As I've given you the cases, the day 1, day 2 cases are different. They never repeat the cases. Okay, that's a different exam, like MRCOG. Okay, everybody please pay attention. Out of these 7 stations, always these 7 stations which are doing in a circuit, 6 are going to be the structured discussions and 1 is going to be the simulated patient task. So only in 1 case, you've got a patient to talk to. Rest, all of them are going to be the structured discussions. Yasmin, almost always we get the repeated stations, but not from the first day. I mean, not in the single exam. For example, you can get the stations from the February or the November exam, but not from your day 1 of May. Do you get that? It's not that day 1 May would get repeated on day 2 May. Yasmin, you get my point? Day 1 May doesn't get repeated on day 2 May, but the older exams, they do get repeated, sweetheart. Okay? Amazing. Thank you. 6 structured discussions and 1 simulated patient task. Do you guys have an idea what a structured discussion is and what a simulated patient task is? Only 1 will have a role player. That is, 3 people would be sitting inside the cubicle. Dunya, Sadia, please pay attention here. In 1 station out of 7, 3 people would be inside. You yourself as a candidate, 1 is going to be the examiner, and 1 is going to be a role player, which would be patient. Sadia, Dunya, simulated patient task means that you're not going to talk in that 1 case to the examiner. Examiner would be sitting quietly with a key. That's it. You don't communicate to the examiner. That is a case where you communicate with the role player only. That is a patient. So out of the 7 in a circuit, which we have done now, just in around these 7 stations, which we did now, you people have to remember that 1 would be where you would talk to the patient. 6 would be where you would talk to the examiner. Clear? Absolutely, my dear Rizwana. It would be uploaded, sweetheart. Yes. Okay? Take good care of yourself, sweetie. Do you guys understand this point? Everyone, are you guys with me? Clear? So 1 would be the simulated patient task. And generally, these cases are where they assess you in your communication. For example, Sadia, for example, Dunia, like a Breaking Bad news. Mehreen, like they give you Breaking Bad news of Anand Kafali, they give you Breaking Bad news. Anomalies they're so fond of. The college loves anomalies and they almost always give omphalocele, gastroschisis. They are fond of diaphragmatic hernia. They always give these type of the simulated patient tasks where you have to break the bad news. In the recent exam, hepatitis B breaking bad news was there. In older to that, it was endometrial cancer as a breaking bad news. Do you guys understand? They give you those patient tasks where they have to assess you in your communication to the patient. I remind you once again, it would be 1 task only. Do you people understand that 1 simulated patient task, which type of questions? I would specifically tell you today when we'll do the circuit 4 p.m. GMT. Today is your first session. I'm talking about the May batch. I would specifically tell you that what do they actually assess you in the simulated patient task. Am I clear about the 1 SPT? How it works? I would coach you today. I'll give you the format of speaking to the patient. I would specifically guide you how you start talking, how you take the history, how you break the bad news, and how you wind up the station. Communication has to be in simple terms, and you don't have to speak medical jargons. We stay very simple to the patient, the role player. Okay? What about the 6 structure discussions? 6 structure discussions, if you see the exam questions, and if I see the inclination of the different exams tested stations, it's almost always a ratio of 4+2 in terms of the Irish guidelines, and 2 are generally the GTGs. Out of these, I would like to tell all of you that in this situation, it is a case where you people should be knowing that 1 is always 1 is a labor ward prioritization. They always give that. Okay, so 1 case is always a labor ward prioritization out of 6 structure discussions. So that means what? If you master your labor ward, you people joined the MRCPI Part 3 that day for a little while. If you master the labor ward prioritization, that means that your 1 of the structure discussion is done with full confidence. If you do it, that's going to be easy for you guys. Did you guys understand this, please? 5 out of those 6 would be other cases. For example, there can be structure discussion regarding maternal medicine. They're very fond of the cardiac cases, coarctation of aorta. They're really, really fond of other cases as well in terms of mitral stenosis, aortic stenosis. All these are exam tested stations. They are very fond of the maternal medicine. Otherwise, intrahepatic cholestasis has been coming up repeatedly. Similarly, the sickle cell disease preconception counseling is super important. They're so fond of this. So what do you need to do? You just need to talk to the examiner in the perfect terms of the presentation, and this should not be a trouble for you guys. Could I make myself clear for the circuit part of the exam, please? Then I'll discuss the long case part. Quickly tell me, please, how many stations in the circuit? Quickly, let me assess that you people have understood. How many stations in the circuit would be there? Out of them, how would be practical stations and how would be the rest one? How many rest stations? How many rest stations? 1 rest stations. 7 practically. Very well done, my dear Sitrahma. Thank you very much, Samia. Perfect, Nagina. 7. Out of 7, how much would be the simulated patient task and how many are going to be the examiner discussion? 1 would be the patient task. Very well done. Where you would talk to the patient, and today will coach you that how you enter into the cubicle. Hello, I'm Dr. Manha, one of the doctors in the antenatal clinic today. May I confirm your name and age? Is it okay to call you Anne? I would give you my specific lines to start and to end and to take the history from the patient in a perfect template. We will start from today, okay? 6 structured discussion out of them. What is the ratio in terms of the labor ward prioritization? 1 labor ward prioritization would be there. Okay, so 5 would be other discussions. And if you do the 30 days cases that's been given to you, I assure that none of the station would be a trouble for you. The questions might be different. For example, for sickle cell disease, we've got 3-4 different recalls. One is the preconception counseling, one is a patient who is on the booking visit, one is the patient who is at the, reaching up to around mid-pregnancy, and they're asking for it. But sickle cell disease is a sickle cell disease. They can't ask anything which is away from the Green Top guideline, right? So if you do your Green Top guideline, the structured discussion should not be a trouble for you guys. Clear? Yes? The understanding of the circuit is clear? Now coming to the part of the long case. Could I just come up to the long case, please? All of you, are you clear about the circuit? If anybody has any questions for the circuit, let's take it, please. Okay, I'd like to take the circuit questions now because we are going to the second part of the exam. Yes, any questions from the circuit, please, before I go to the long case? Let's finalize the circuit thing so that I can understand and I'm confident that you people have understood the circuit, please. Any questions from the circuit part? So I move to the long case then. This is one part of the exam, right? 7 stations. How many cases labor ward prioritization, please? Mehreen, what does it mean? Okay, number of cases. Yeah, okay. It's not like MRCT part 3. Maximum which we have in the exam tested stations is 8. They have not given more than 8, Mehreen, up till now. 8 maximum. This time in the February, probably there were 6. Yeah, but more than 8, they've not given till now. Got it? Thank you so much, Vifak. So happy to have you here, my dear. Labor ward, how to prepare. Manha, the way I am going to prepare you guys, it's my responsibility. You people, I will give you a word for each case and I will solve each and every labor ward that's coming up. If you go to the website, there is a complete folder on a labor ward prioritization. If you do those around 20 pages folder that has all the exam tested stations with its applied clinical knowledge, what you have to speak, I will tell you how you have to start, how you have to end. And that 20-page folder, that's absolutely sufficient. Not even a single word will be coming up apart from that. Why? Because it has got all the applied clinical knowledge which is required for the labor ward prioritization. And I have multiple labor ward prioritizations with you guys. Okay? Got it? Okay. Or any written station? No, Sabha Malik. There is never a written station. You don't have to write anything. So far, it never happened in this. Okay. Or all interactive. All you have to speak, Sabha. All the stations you have to speak only. All right. Instruction questions will be given along with the case. All right. That's a very good question. Everybody, please pay attention. So what happens here is that if you people have to see, everybody, please pay attention. It's different from MRCOG 3. You have the cubicle. This is the door of the cubicle. Everybody, please pay attention here. So this is the door of the cubicle, and you stand here for 2 minutes. You wait to go inside because the examiner is marking at that point the previous student. This is the table inside. When the 2 minutes are over, you go inside, they start your 10 minutes. In that very 10 minutes, you have to read on the table whatever is written here. And you say, I'm ready to start the discussion. So in front of you on the table for 10 minutes would be your task. Do you guys understand? Samya? Samya, my dear. Then you complete your 10 minutes here. You move to the next cubicle. This is the wall of the cubicle, that door of the cubicle, that partition which they have made. And this would be the table inside. You'll stand here for 2 minutes because the examiner inside is marking the previous student, right? Previous candidate. They'll hand over the result and you will go inside. And here you will have your reading time. You will read it and say that I'm ready for the structured discussion. I've read the instructions. Claire, Samya, this is answer for you. So on the table is your instructions in front of you throughout your 10 minutes. A very good question, Sitra Hamad. Absolutely. Forceps vacuum back from 2018 and 17 recalls, they have been there. So you are going to do all the dummy things, the shoulder dystocia, the forceps application vacuum. So don't worry. So people who would be joining in, I would be in touch with you guys for the UAE students as well, and for the Ireland students as well. You people can meet while reaching to the venue as well, and we can have that on-site thing later. Okay, so you people just stay connected. Everything will be there, but it would be just 2-3 days. When you reach your venue, we can have a discussion. All the registered students, we can have a discussion on this on both the venues. We can manage. All right. Okay. So any station which asks us, Sidra Hamad, okay, I've answered this. Need to perform, apply, forceps, marina, and vacuum. Vacuum is a recall station. Marina so far has not come, but back in 2018, copper IUCD was one of the station insertion on a model. But for the recent exams, 3 years, it's not been there. All right, Sadia? Copper IUCD was one of the station, but very old recall. But yes, I tell students that they should do it. Okay, so we are going to provide you everything on this. Okay, in SPT, ma'am, will there be any procedure or drill? No, Fahima, all of you, please remember, you never have to touch anybody in exam. If you're touching somebody, that would be model only, mannequin only. All right, so no procedure in a simulated patient task. You don't have to touch the patient, please. Okay, no handshaking, no touching, nothing at all. It's all about communication. They will be sitting on the other side of the table. They will be sitting away from you. You don't have to touch them. If they ask you in a long case for examination, that too is on dummy only. Got it, my dear Fahima? Can examiner ask direct question from outside the marking list? Yasmin, generally they do not do. You keep on seeing them putting, the mark sheet is there. They keep on putting tick, 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 tick. And you understand that you're going on the right direction. They've got marks. I'll show you the mark sheet today as well when we'll do the circuit. You'll see this is type of mark sheet. So they have points here. I'll make it on the whiteboard for you guys. Yeah. Okay. So this is how the mark sheet is, right? They've got the points here, right? Different points. For example, it's sickle cell disease, it's preconception counseling. So you have to mention, you mentioned rubella, smoking and stuff. So if you're fine, they put the tick there on different points. Different points are given there that these are the things in the preconception they have to mention. These are the antenatal points. You keep on speaking and you see your hand move, their hand moving. And then it is this, if you are missing out something, they put the ticks across there that this is like a borderline thing. Here, they write that pass, or it's a borderline, or if it's a failing, right? So for passing, they give you a tick here. For the borderline, they put you a tick here. For the failing, they put tick here. And at times, they don't hide it. It's just in front of you. And it's quite reassuring when you're speaking up the things. If you miss any point, for example, in the antenatal care, you're missing up aspirin. So they'll put in this box that this is something which was missed, that they can prove themselves that yes, it's a borderline. Why? Because the student didn't mention aspirin in the discussion. Yasmin, do you get that? So these keys are then submitted in those 2 minutes when you're standing outside the cubicle. The coordinator of the exam, they keep on collecting those keys from them. Do you guys get that? Trying to be very, very detailed and elaborate with you guys so that this is the first step of being confident that you understand the system of the exam. Got it? Okay, any questions from circuit further, please, before I go to the long case? Yes, any question from the circuit further? In circuit, your all 42 Irish guidelines should be on your tips. They're so fond of giving at least 3 to 4 stations from the Irish guidelines. They give, generally the Irish guidelines like NPD guideline, fetal growth restriction is a very common structured discussion. They ask you about the algorithm so much. So if you have good grip over your Irish guidelines, structured discussion is not a problem for you guys. 1 is labor ward, 3, 4 would be Irish guidelines. 1 would be a breaking bad news or a cancer station. So, it's all very predictable type of, practice. Okay. Shall we go to the long cases, friends? Hi, shall we go to the long cases? Yes, that's how it is? Everyone? Yeah, one more thing I had to tell you, that in the beginning of the exam, they give you certain stickers, right? They give you certain stickers. No, don't worry, Sadia. They're very, very easy. Yeah, Faima, they give you these stickers. Now, what do they do? For example, you're in the waiting room, right? So they will announce your number and they'll give you the stickers for this. So the stickers when they give you is like different like this, they just give you one, which you have to, they take, of course, your mobiles, they take your, if you've got some watches or any smart watches or something, they take it. So you just put one sticker you'll use and you'll put on them, right? Then they also have certain things like, for example, for the stickers, they tell you if you are moving in a circuit, right? So you go in a circuit and they've got this examiner sheet, right? When you have this examiner sheet, they tell you in the situation, for example, this is the cubicle and you're standing outside here. This is the table. You'll have the stickers in your hand. You go inside and you introduce yourself that, hi, I'm Dr. Mana, one of the exam candidates for today. So I'm here to read about the instructions you're going to give. So they'll say that please give your sticker. They'll have their examiner sheet on the top of it. They'll put your sticker here and then they'll start marking. So because the students in different batches are coming up, so then you'll hold that sticker sheet and you'll come out. That sticker sheet is with you only. You'll go inside on the second cubicle. Again, you'll go in and you'll give the sticker. So basically your 7 stickers would be utilized in your circuit. Do you guys get that? So when you're going inside, those stickers they take from you, that is basically what? That is basically they're putting on the page for your marking so that there is no confusion and they don't mix up any of the candidates' result because it's just spontaneous. So that's why. Fahima, do you get that? That what these stickers are? Right? Sadia, it depends on writing in a paper. For example, they give you 2 minutes for the breaking bad news of Anand Caffley. So I will be sitting inside and this paper would be in front of me and the pen would be there only. On the table, there's got a paper and a pen, okay? So you can write name of the patient that she's Ella and she is 28 years. Anomaly scan's been done. Her BMI is 24 if it's given. So I'll write my points. Okay, I would like to have her folic acid history, her neural tube defects history, and all these details. So I keep on writing on the page. So what you people have to organize yourself that you should not be forgetting in 10 minutes. You should write on a paper. That's specifically when you're talking to the patient. In a structured discussion, it doesn't require, but you should be knowing like name should be in front of you so that you don't mix up. So paper is given to you if you want to write anything. Okay, for long case, of course, I'll give you my mnemonics and I'll give you certain points that, how you have to organize yourself so that you people know. I mean, the way I used to do for myself, the histories and the way I used to for myself, used to do the examination part. So I used to put on the paper so that you don't forget anything in the examination. All right, this is to organize yourself. Am I clear, Fahima? Am I clear, my dear? Yes, Manha, got it? Okay, my dear. All right. So now let's go to the long case. Now, again, the long case, thank you very much, my girl. Long case can be in the morning first, and after a break, it can be a circuit. So the break can be as short as 30 minutes and as long as like 2-3 hours. Okay, it depends upon which batch you are in because the batch keeps on going, If you're in first batch of the circuit, you'll get free, but then your long case would be longer break. So if you are in the last batch, then you might have a little earlier long case. It depends upon where you are in your batch in that day, okay? As the batches are of like 7-8 candidates, as I told you, okay? Now, with this, in the recent exam, it was in the morning. In Oman exam, it was in the later part. So it depends where it is. But one of the part in the morning or in the afternoon, then they'll divide the batches accordingly, the long cases versus the circuit, because examiners are the same generally. In long case, you can have one long case. So the total exam which you have to do is one long case and 7 circuit stations. That's it. This is the total exam, which is, I would say, almost 50% of that of what we do in the MRCPI Part 3. MRCPI Part 3 is a long exam that drains you like so much. Here, you don't get too much of draining. It's there. It's not much exhaustion because it's a smaller exam comparatively if you compare to the other OSCEs. Okay? But of course, who's taking for the first time, the exam is an exam. You do have its nervousness. That's pretty much understandable. So to begin with, the long case is you are given 25 minutes. All right? 25 minutes. For the long case, you people have to understand that either you will get an obstetric case or you will get a gynecology. So it's not that you have to give both the cases. Either it will be an obs case or it would be a gynecology case. Very, very common cases they come. They don't give you some unusual things at all. For example, breech presentation for the antenatal or for the labor care. They would give you hypertension, preeclampsia, very, very favorite of exam. They would give you an obstetrics, the intrahepatic cholestasis as a long case. They can give you as long cases. I've got a huge collection in which the minimum, maximum, or list is there, which we would give you, that this is what you have to do. Sickle cell disease up till now has not come, generally not as a long case, but it can come. That's something which you should be prepared for. Similarly, they can give you anything like any maternal medicine disorder, any cardiac problem as well. They can give you an obstetrics, a patient with a transverse lie. Breech is very commonly asked. In gynecology, they're very, very fond of HMB. They're very fond of the fibroid. They're also fond of the prolapse cases. They're fond of the gynecological problems, the urogyne problems as well, like SUIs, overactive bladders. They're very important for the structure discussion, also for the long cases. So I would give a list which you people would have to prepare. What is the difference in the preparation? In long case, you will enter into the cubicle. And once you enter into the cubicle, you will have the two examiners sitting here. Okay, so two examiners will be sitting here. Generally, they give you a chair, and the role player, you and role player generally are sitting in front to each other. Just in the same room, we have a couch here where dummy would be there. Or students were saying that they were just putting a pillow, right? Just to, for the obstetric case, just to mimic the abdomen. They just had to see the maneuvers which you people are doing in the abdominal examination. This is the picture you people have to keep in mind. When you go inside from the door, bell starts for 25 minutes. Halfway, when the half time is over, there will be a bell ringing. That to tell you that only the half time is remaining. And this, what you guys have to do in the long case. You have to take history, complete history, thorough history, because that will be on the basis of your history, you will come up to your differential diagnosis, and you have to do the examination. My way was that in half of the time it should be done, right? And then after examination, you start having your discussion with the examiners. One of the examiner would discuss the history, and the first examiner, the history and examination findings. The second examiner discusses the topic. For example, it's HMB. So the second examiner gives you the viva questions, anything about HMB. And the first one discusses about what you have done in your history and your examination. The scenario is given on the table here. That's not a longer one. They give you, like, for example, 3-4 lines. That's it. That patient name is this, age is this, has come up with this hypertension, preeclampsia, has come up with heavy bleeding. Do you guys get that? So generally, you have to divide the time, and the examiners also do a prompt if you're taking too much time. You can't take too much time because you have to take a thorough history, then examine the patient. Once sitting in, you take the history. The examiner would leave the place and come besides you, saying that please examine. And once you start doing the examination, they would see you, basically, they're marking you on your steps. So I always say to students that it's not something where you have to pick up the findings, because it's just a dummy, and you just have, at times, they just put a pelvis in front. It's all about speaking. It's all about showing yourself to be sensitive to the patient, respectful to the patient. It's about acting in that situation. So that's very, very easy. If you open up your study group, there's a complete gynecological and obstetric examination folder there. I will add certain points in them, which I added for myself. For example, my way was that I'll take care of the patient's respect and dignity, will ensure that the curtains are there and the patient is not having any pain anywhere. Would talk to her. I will ensure that my hands are warm. All these things. There is no wristwatch, there's no jewelry. So be very comfortable. All these things now you have to speak no matter the actual patient is there, then you talk to the patient. If no actual patient is there, even then you have to speak. Do you guys understand? They are giving you score for your words and your steps. For gynecological or for the obstetric examination, you should be skilled in general physical examination, your systemic examination. What you have to speak, no added sounds are there about the respiratory examination. For complete, I will give you lines which you have to speak. You will learn that and you will speak them. That's it. Nobody would give you a stethoscope to find the added sounds on the chest. You don't have to pick up a wheeze. You don't have to pick up a murmur. So don't get overwhelmed by that. But what to see, what to speak, that should be on my students' tips. For that, I would be very strict. You should be knowing what we have to see, right? You don't have to take anything with you. Everything is on the table. They give you an inches tape to see the fundal height. So you'll see that there only. And they don't actually give you the right fundal height. It's just a pillow or it's just a dummy. They just see that you know. So you speak the steps, right? That inches will be on the top side. You keep on seeing that, how you do the Leopold's maneuver, how you do the pelvic grip. All this is given in your study group. The entire folder is given there. Please go to the file section. All the folder of the examination step-wise is there. You just have to learn this. And once you'll be presenting to me, I'll add lines on that. You'll make your notes according to my lines, that this is to be spoken to impress the examiner and to be patient safe while examination, right? Then nothing would be difficult for you guys. But knowing that what you have to speak is very important. What is the interpretation of the fundal grip? What is the interpretation of the pelvic grip? How to determine the back of the baby? All this you should be speaking up because there would not be any exact finding. Do you guys understand? After that would be your topic discussion for 10 minutes. So I repeat, you take complete history. It is in the study group. Telegram, please. It is in the study group, Telegram, your study group. It's there. All right? Okay. So all of you, please remember that you'll introduce yourself. You'll talk to the patient. You will take a very good history. I'll be very, very strict in history. This history, which you're going to take here, would be the same which you're going to take in your one station SPT in the circuit. Do you guys understand? So when you prepare your circuit station, the same history would be here as well because you're talking to the patient. Do you guys understand? Yes? Exactly, absolutely. We actually ask in the history everything. Do you know about your weight to height ratio? Right? And in general physical examination, you also say that I would like to assess. It is part of the general physical examination as well, my dear. Generally 7 to 10 minutes. 7 minutes for the history is too much, not more than that, please. I will give you exact description. When you'll do that, I will give you exact marking that it should not be more than this. All right, Rania, you're in which group, my dear? Rania, you're in the November batch WhatsApp, right? Rania, in the November batch WhatsApp, right? Rania, yes, for November batch, up till now, Telegram is not made because the audios are not being posted. The course is going to be started after this May exam. So you all have the access to the website and the Telegram group, that is the channel. Okay, I'll post the things there. For May, I've made the Telegram because the course is active. I mean, in terms of the live sessions. Okay, but the website access is started with you. Fahima, one in the circuit and second in the long case. That's it. Yes, one in the circuit and second in the long case. Now I have to discuss one thing very important with you guys. Students in this recent exam also, they faced difficulty and few of the students, they failed in this. Please try and understand. Once you take the history, all of you, Sadia, you just have to speak it. They don't let you take. Till now, they've never asked you for this, but you should be knowing the way. I always say that where to put the sphygmomanometer, where to put the fingers, how to put the stethoscope, you should be clear about this. Okay. All of you, please pay attention here. Once you take the history from the patient is there. You do the examination on the dummy. You go back and sit on your chair. When you sit on your chair, the examiner starts asking a question. During that question, they might say, can you explain this condition to your patient? Please revert back to the patient if they ask certain things. For example, they say, can you please explain this fibroid to the patient? So you have to say, all right, Anne. So after your history and examination, I would like to tell you that this is a condition where there is an innocent growth from the womb. We call it as a fibroid, which is the reason that you're having the heavy periods. Are you with me? I can draw it for you to make you understand that this is the womb and the growth can be outside or can be in the wall of the womb or can be in the cavity of the womb as well. In your case, the findings, they suggest that it's in the inner cavity, therefore it is causing heavy periods. Are you with me? And the examiner would prompt and say, thank you, next question. So whenever they say that it is a situation where you have to explain the finding to the patient in between, please talk to the patient then. Then don't talk to the examiner terms. If they say, can you please explain this condition to the patient? Do you guys get that? Do you guys get that? It's always that whatever is the scenario or the diagnosis, they want you to explain that to the patient as well. Can I make it clear to you guys? Yes? All right. Thank you very much. Any questions from the long case, please? Anything which you people have not understood from the long case? Remember, it is an exam where circuit separately should be passed. Long case separately should be passed. If you fail the circuit, unfortunately, the exam is failing. And if you fail the long case, exam is failing. So both have to be passed separately. Right? Samya, my way was around 5 minutes and plus around 2-3 minutes for the examination. They prompt you as well. So you should be good in history taking in around 5 to 6 minutes. That is something you should be training. I will train you for that. Today only, 4 p.m. GMT, guys, we have got a circuit today. So you people would understand in the history taking, because when I am doing a circuit and I'm doing an SPP, the same simulated patient task would be long case history as well. So I will tell you that time. Do you guys get that? Yes, yes, complete circuit result. Complete circuit result. Exactly, yes, Ria. They give you a paper which is given on the table. For example, you enter into the table. This is your table. This is your discussion here. And you've got a paper and a pen here. And inches tape and certain instruments are on this table as well. Whatever they want you to have, that's there. You don't have to take anything along. Okay, yes, Ria, my dear. We should be limited. Sorry, I didn't get that, Sadia. We should be limited to what? Limited, my dear? What do you mean? Limited to us? No, I'm not getting the question, sweetie. Elaborate the question, please. Do we need to ask examiner about the investigation results? They give you themselves. Nagina, you know, what do they say? They say that, okay, you've taken the history. They would mark you on your history. They would say, Nagina, that perform the examination. You will say that these are the examination steps. They will give you the examination findings. They would say what investigations you would like to do. So you would say that, for example, if it's a preeclampsia case, you would say that I would like to have the liver function test, the renal function test, or I would like to have the coagulation profile for this patient of mine, right? So then they would give you the result. And I would like to have the ultrasound findings for this patient, recent ultrasound findings. May I know the date of the ultrasound that's been done? They will give you the findings. And then you're going to start. Got it? Everyone, did you guys get that? So then you will say, okay, the investigation findings are be provided to me, and then you come to the discussion of the case. Razia Faisal, the pelvic examination generally they ask you to do. For example, few of the cases they said, can you take the pap smear? They wanted to take the smear. For the abdominal examination, they want you to do the obstetric maneuvers, the Leopold's maneuvers, the fundal grip, the pelvic grip. So because only the pelvis is there, I mean, at times they just put a pillow, they just want to see your maneuvers, that's it. But it's just about acting again because the actual patient is not there. It's just a dummy. That's why. Okay. Ria, I will give you my way. My way was doing with the mnemonics so that you're very, very confident. I used to do it this way so that you don't miss out anything. I will coach you according to my way, right? I don't know how others used to do, but I used to do it like so that the things are not forgotten and in a smooth go. And I always used to say, "All right, Anne, I would like to get permission so that while talking to you, can I just take important points noted?" So that's a very good decorum of talking to the patient. So during our talk, would like to note down some important points. So she says, yes, sure. So that's a good way of doing that so that the role player doesn't feel and the examiner gets impressed as well. So with your permission, would like to take certain important points of the history. So, this type of way is a comfortable way to talk. All right. So I will do that, Fahima. For example, today also I will tell you about one. Okay. Today also I will do one. What I've decided is that in every circuit, in the 5 sessions, I will do one myself today so that you people from the start, you people know circuit versus long cases both with me side by side. Okay. So I will tell you my mnemonics. I will tell you my way so that you people are organized and there's not a problem. Like the way I used to organize myself and the page, and there would not be a problem for you guys. All right. Okay. From today, we'll start circuit plus long case. One long case in every session I would do to tell you guys that, for example, it's a simulated patient task. If it comes as a structured discussion, what would it be? And if it comes as a long case, what would it be? All right. Okay. So all of you, please, any questions from the long case, please? Did you guys understand? Now the question is that you people have understood the exam pattern, and it is a circuit stations, 7 we have, 1 labor ward prioritization, and this is going to be 6. All is going to be posted, Sadia. I would tell the moderator, she's going to post everything for you guys. All right. And the long cases, 1 you people would have either obstetrics or gynecology. The past important topics we have, if you do those topics, right? If you do all those past topics, endometrial hyperplasia, I always say it's almost 99% that it's coming up in exam. None of the exam is complete. They're so fond of it. Diabetes mellitus, they love it. Maternal collapse, so important. They simply ask this by so many ways. As they're loving platelets in the written exam, they really love the ITP here also, in OSCE also. They always ask a question in the structured discussion. And all these solved templates are available. They will be there in your study group. If you people know the gist and the presentation skills, nothing should be a problem for you guys. They've given a complete way that how the stations would be. They're nothing out of this world. I always say, absolutely, Rania. For you guys, November, no, my dear, May schedule is started. You will have self-reading till May. The library is open for you guys. All right? Sidra Hamad, for example, hysterectomy. Abdominal hysterectomy and vaginal hysterectomy is so important station. They love abdominal and vaginal hysterectomy. They also ask about myomectomy. They also ask about sterilization, right? So you people will have lots of sessions. You people will have 7 sessions on the long cases. You people will have lots of discussions on the long cases. You people would have around 35 live circuit stations with me, right? Which I would give you the model answers. And my expectation is that from today, those 30 days topic, which I have given to you, they should be on your tips. Up till now, Sadia surgical knot has not come. Up till now, it is not an exam question for MRCPI. I mean, since 2015 till now, it's not an exam station. All right. Okay, so our expectation is that you make a notebook and you solve all those tips which I'm giving you today. You will take all the tips of the circuit presentation from the first session. You will add on your notes, and I would be very strict in how you enter into the cubicle, how you start your presentation, how you end up your presentation. I want a very confident attire from my students. The long case, I would tell you that how you start the long case, how you wind up the long case, how you present yourself in the long case, and you people should be ready for it from today only so that you're in the right direction, please. I request all of you to make sure that you people know, the ones who have still not joined, the May link is already there. If you are planning for May, then I want at least 7 to 8 hours from you guys. The November link is also there, and you people can join the November link and you'll be in the study group for November. The library would open now and you people can start. We don't have any Roshna, any OSCE books separately, but MRCOG Part 3 OSCE books are available. But again, I would say that you can take the help from those, right? You can take help from those, but my request to all of you is that these topics, which I've given a study plan, these should be on your tips. All these topics should be on your tips. These, if you do it, it should not be a problem for you guys because these are repeatedly coming up in your exam. And if you make a note and solve these 30-day study plan, nothing should be a trouble for you guys. Please take its print out, write down its template and make these topics which are given in the PDF, that's it. You don't need to do any single thing extra, right? Absolutely, my dear. You don't need to go anywhere. Samia, you'll be appearing in Dubai? Yes? So the only thing is that, yes, the before exam while reaching, you can get connected. Ireland, no worries at all. Before that, you can get connected. Otherwise, it's absolutely okay. You don't need any hospital for this, my dear. Nobody goes to hospital for OSCE preparation. All right? No problem, Sadia. There's not a problem. Nobody is working. All are taking just, and many of them, they've not even started their hospital routine. So that's not a problem at all. All right? Who applied now to get accepted for May exam? Now, this is a very difficult question, my dear. We can't comment upon that, Roshna, because Sidra Hamad, because even last time, this is a very challenging situation. Everybody, please pay attention. In the first go, if you people don't get a seat acceptance, please don't worry. Reason for that is that they keep on giving date. For example, if they'll email today that Sadia has got seat, so Sadia will get like 3 to 5 days to pay. If she doesn't pay in those 3 to 5 days, the seat goes to the next. So the next email gets. Then again, the next email gets. Then again, the next email. Believe me, my topper of November batch, she got 10 days before exam, she got the acceptance. And I told her, because she had done MRCPI Part 3 with me, I told her that no, you have to appear. And she taught the MRCPI OSCE that time. So when you people get the email, you get a window period of this like 3 to 5 days to book. If somebody doesn't book, so that goes like next, and that keeps on going the same way. So you have a chance even 10 or 15 days before exam that you'll get the acceptance. This keeps on happening. Now they don't have a backlog because they've increased the diets. Now the 3 times it's an exam in a year. So they don't have the backlog. So the chances are that you all will get the seats. Last time in the first go, everybody appeared, right? Got it? So no, it's not Khushbu. Khushbu, sweetheart, if you have appeared in Part 2 written, you're eligible for Part 3. Okay, I mean Part 2, they don't call it Part 3, my dear. They say Part 2 written and Part 2 OSCE. So eligibility is before Part 2. That's it. It's different, Khushbu. Okay. If you're eligible, if you've passed Part 2 written, that's it. Tell something about what to do to get visa. Should we try to get visa now? Fahima, from where? Fahima, from where, my dear? From where to where? To Ireland? Not a problem, my dear. That's not a problem. You'll get it. That's not an issue at all. You can just call the embassy now and they'll tell you there's a very minimum time. That's the safest visa, sweetheart. Okay? You can just call them now and just ask that what are the prerequisites. Get connected to me. I will help you with that. Okay? No worries at all. All right? Okay. And others who think that they will be taking long for travel, please get connected to the embassies so that you people can just take the requirement and the prerequisites are fulfilled if they have any requirement of the documents. One more thing, please. College also sends an invitation. All of you, college sends an invitation. So you can also attach that to make your application stronger. All right, all of you. The college sends, when it confirms that you're going to appear in exam, they send an invitation. You can attach that as well. But it's, of course, when you get the seat, then they send the invitation. All right? If you feel that it will be rejected for some reason, you people can do it this way as well. All right? Absolutely. I've got a complete congenital anomalies folder that is solved. All in one folder. All anomalies I've solved in one folder. Okay, so nothing to worry. See, these stations you'll get all in hand. What I want from you guys is that you people speak. Janani, my dearest, I would definitely like you to book, but if you can give this much time, which I'm asking for, you'll get that in the everything you'll get in the study group, sweetheart. Yes. Yes, exactly, Seher. You have that on the folder as well. You'll get that in the Telegram as well. Okay. All the anomalies, I have got that. Library Mehreen starts now only. Yes, all library Mehreen opens now only, my dearest. Just now. Yes, only the live sessions I'll start from June or July. I mean, somewhere closer so that you people have, good practice. Okay, but the library starts for everyone. Whosoever is registered in the May group or in the November group, you people have started your library. The difference is that the May batch is starting their live sessions now, and many November students have joined the May batch as well. They will just extend it 125 to November. Their library would be extended and they'll be in the next group as well. But otherwise, the May live sessions I'm starting from today, and the November one would be started like 3 months before. Okay? No, my dear, it's not possible. Otherwise, you'll have to join the May batch. And then you'll have to do the extension fee and then join the November batch. All right? Otherwise, May is a separate study group. All right? Okay, many students have done that. They've joined the May batch, and then in 125, they will do the extension to the November. At least 10 students, they've done that. That, ma'am, we are for November, but we want to start early. So we are joining the May batch. We'll not appear in May, and then we'll give the extension fee and we'll join the November again. So they have done that. So it depends. No problem. You can still switch over. That's not an issue, my dear. That's not an issue. It depends upon how long preparation you guys need. Okay. So that's not an issue. Okay. All right, my dear. My dear Deepa, I would do that in the session, live session today. That's what we are meeting for today. All right, we'll do everything. And I've discussed from the beginning. Yes, that's sure, Yasmin. You all are welcome to be this way. You are part of me and part of family. So that's not an issue until unless you get this completed degree. We are going to stay together and we'll work hard in the right direction. Yes, Vifag. Generally, the dress pants and dress shirts are preferred. The boys are always in some collar shirt, and it's better that you wear a dress shirt and a pullover, a coat, and a dress pant. That is always preferred. But you see multiple people in different type of in different centers, Yeah. So you can wear skirts as well with a blouse and a coat on that, a blazer on that. So anything which is formal that looks good. Okay. No problem, my dear Deepa. Everything would be just uploaded in a few hours on the portal. Khushbu, the dress pant and the dress shirt, and you can just wear a blazer over that. Yeah. Okay. Absolutely no jeans, please. Don't be casual. I'll have a complete discussion. 10 days before exam, I would tell you everything what you're wearing. I'll check all the dresses and everything, and then we are going to have a finalized one. Don't worry at all. Okay. Comfortable shoes as well. Absolutely, Mana. Comfortable and something which is not very formal and not very casual. It should be somewhere semi-formal. Okay. Absolutely not. No white coat, no label dresses, no nothing like scrubs or something, nothing like that. No doctor coats or the white coats, nothing like that. You have to come into your own dresses, and it's always better to wear something semi-formal. Okay, absolutely no worries at all. Thank you so much. Yes, Sidra Pervez, it's absolutely the same idea, but it's a little easier as less patients are there. Maximum Sidra, as per the stations which we have, 8 is the maximum count. In the recent exam, it was 6. So they play around Sidra around 4 to 8. Yeah, this is what they do. So it's not very long as that of MRCOG. So that's a good point. But the discussion goes longer. Yeah, it asks so many questions for each patient. right? Okay. So all are ready to get started, please. So 4 p.m. GMT, see you guys with the first circuit discussion today. And I'm going to tell you guys that how the circuit stations are. You people know the topics for today? You people know the topics for today? Yes, that's perfect. Rania, it's not for you, please. It's for May batch. It's for May batch. Yes, Vidhi. Vidhi, post the topics once again, which we are going to have a discussion today. Okay. Guide for November, oski for MRCPI. Yes, Roshna, that's a very good question. Roshna, my students have passed in this November. You people saw Sheila in the winners and the champions just in the first slide, right? Can you imagine in November she took MRCPI, MRCOG, and EPCOC OSCE all in 10 days gap, traveling from one place to the other, and all 3 OSCEs she passed in November with me. Got it? So it's not a problem, please. Yeah, after May exam, my dear. Of course, after May exam. For November students, after May exam. You don't have to do so much of early sessions now because I'll also include these stations with you guys. Ume, my dear, Rumi, these stations also I will include, I mean, of the May exam, right? For November, you have to be updated. Do you get that? Like we used to have the fast track, sweetheart? Yes? So you need to get the updated things if you're appearing in November. Do you get my point? Yeah? All right. Thank you so much. Thank you. If you wish to join the May batch, you can just switch over to the May batch and then you can extend later. See, nobody knows that is something which for MRCPI written and MRCPI OSCE, that's always a confusion. You get to know at the very late point. So it's okay. At least we can try our luck. Okay. Abir, I will have 10 days, very, very quick revision. Yes. 10 days before exam. Once you'll get the seats, then very quick revision would be there. Okay. With the mocks announcement. We'll do mocks. Okay. Right? Absolutely, my dear. We'll put that. Yes, we'll put that. Yes, Ahmad, we'll do that, my dear. Okay, we'll share the link for you guys so that you can listen to it. All right, so I hope that now you guys, you just tell me, just drop in a message to my WhatsApp. All right? Okay. Khushbu, I think you didn't start from the beginning. I told especially the hours in the beginning that how many hours I need from you guys. 6 to 8 if you're pairing for May and around 1 hour per day if it's November. Thank you so much, Nakina. My pleasure, sweetheart. All right, friends. So give me a thumbs up that you all are clear. Thank you so much, Fahima. You will do that. Thank you so much. I hope now you people are in a better position to understand the gist of the exam, to understand what OSCE is. Lovely. Give me a thumbs up that you all are ready to ace this exam and you promise me your hard work and I promise you the success. We all are going to make it a success together. Absolutely, Razia. Then there will be more chances. Thank you so much. That's like my happy family and that's like my RFA alumni. Thank you very much. See you guys 4 p.m. GMT with the circuit discussion. Thank you very much. If any questions are there, now we'll practically start speaking, communicating, and addressing concerns. And we all would make it a success together. We'll do those most important topics on a priority. And after that, we can do anything that's left over. But the most important thing is that the first things are going to be on your tips. Those important cases should be on your tips. All the questions would be all the recordings would be uploaded on your portal and you can revise them as many times as you want. All right. Yes, Shazia, the recording would be uploaded. I think the team is going to take around 3 to 4 hours and that will be, the link will be with you guys. Okay. Love you all. Take very good care of yourself. May this journey, the first step which you're taking today, be full of blessings. May every day, may the best of health, the best of the care plan be with you guys, and may everything, whatever you're aiming for, come out to be happiness and success for all of you. Take very good care of yourself. Stay confident. Have faith in yourself. On the top of the notebook, which you're making today of MRCPI OSCE, I want a line. I can do it. I will do it. And we would see meeting again on the celebration Zoom session. And we will cherish this day when we took the first step. I have full faith in you guys. I know your potential more than what you people know about yourself. I have been coaching you for so long. Now I want that the last step we make it a success in one go. Thank you so much. Love you all. Take very good care of yourself. Prayers with you guys. I need confidence. I need faith. I need a family studying together, helping each other. Let's do it. Thank you so much. See you guys in the circuit discussion. Thank you. Bye bye from my side. Take good care. Love you all. Thank you so much.